everyone, this is my third try at going live. I'm under a lot of stress and a lot of people around me are as well, including patients. This week, everybody's mentioned it. We even had people coming into our office who were looking for a different office. A lot of people. It happens from time to time, but it's been quite a few. I've heard a little bit more road rage. People are stressed. By the way, my name's Kimberly Brown, Dr. Kimberly Brown. I'm a licensed naturopathic doctor in the city of San Jose in California. So, I think we all know why people are under stress right now. There's a really big election happening next week. So, it hit me this week too. So I'm under stress. Like I said, it's the third time I'm trying to do this. That's a first. Usually pretty comfortable doing this. So, stress and perimenopause, what to do? Well, if you can just get away from it all, that would be great. If you could go to a nice beach for 3 months, that could pretty much solve everything. Unfortunately, we can't do that. So you'll see that there's a lot of adrenal formulas. You'll hear about adrenals, support your adrenals. Are you under stress? Love adrenal herbs. That's my favorite. You'll also see combinations with B vitamins, vitamin C. Vitamin C is great for your adrenals. But I prefer the herbs, and that's because we're often getting those other nutrients from different supplements or from our food. For instance, I've had patients come in over the years with things they've bought online, and there's just so much vitamin B6 in it. Vitamin B6 can help most people. Some people it doesn't, and they start to build up what we call these histamine products, and it actually causes them to feel more stressed out. So I prefer just using herbs with adrenal support, and with some people I'll do some targeted nutritional support as well. The adrenal herbs do work, but it's nothing like pharmaceutical drugs. It can take a lot longer. Some of the herbs that we use to calm cortisol, to go to sleep, does help, and pretty quickly. What I do find is I have to change up adrenal support. So what works, what doesn't work, and what should you be careful about? Well, I think the most popular adrenal support herb out there is ashwagandha. Ashwagandha is very safe, even at higher dosages. The one group that needs to be careful about that are people with autoimmune disorders, because ashwagandha can stimulate the immune system. Now, so can other adrenal support herbs like the mushrooms. They also stimulate the immune system, but my favorite would be cordyceps. I can use that with people with autoimmune disorders. Let's see, but cordyceps is not used as much, and probably because it's pretty expensive, so I use it sparingly, and oftentimes with people who are getting really sick a lot, because it can really support your immune system. Let's see what else is out there. My personal favorite is Tulsi, holy basil. That's an Ayurvedic herb, just like ashwagandha, and I like it because it really tastes good in the tea form. So I'm already taking a lot of supplements, so if I can do something in a tasty tea, that's what I prefer. And there's no contraindications as far as I know with Tulsi. Let's see, what else? Licorice. Not my favorite. If a patient of mine has low blood pressure, sure. But licorice can cause your blood pressure to rise, so we need to be careful with that. And technically I've only seen it do that when somebody was overdosing on licorice tincture, but still we need to be careful with people that have high blood pressure, and so not personally my favorite herb to use. Maca. We love maca. We love maca because it supports the hormones, as well as balancing out cortisol. But there are some studies showing that it can suppress thyroid function. And I think it does that because it can increase your testosterone and estrogen. And when you do that, your thyroid hormones can decrease. So you need to be careful with people with hypothyroidism. Let's see, am I forgetting any? Yes, ginseng. Not American ginseng. That's an endangered plant. So we don't use American ginseng. We use Siberian ginseng, which is just as good, if not better, and it's excellent at balancing cortisol. I feel like Siberian ginseng is maybe the most gentle herb. Rhodiola. Love rhodiola, except, not everybody loves rhodiola because it can make you feel jittery. And definitely if you have bipolar disorder, you need to stay away from rhodiola. I think it can trigger mania. And treat it like caffeine. Don't take it too late. So some of the safest things that you find out there online would be a combination product. But be careful with rhodiola and licorice. People with hypertension, you've got to avoid licorice, at least in a supplement form. For people with bipolar disorder, definitely need to avoid rhodiola. Now, what I said about ashwagandha and maca, clinically, I don't necessarily see it causing those issues. So I'm not so worried about the safety profile. There are some other herbs, like Schizandra. It's usually used in small amounts, and it's not an herb I really know a ton about. I don't think it's a really strong adrenal support, but I could be wrong there. Let's see. What I really like to do to support the adrenals is support my patients in whatever brings them joy and relaxation, a sense of peace. So for me personally, it is going for a walk with my dog, being out in nature, hiking, going to the beach. Now, for somebody else, it might be hanging out with friends and family, doing something social, cooking, having a nice meal, being really active. Some people, they want to go to the gym and then just bike for an hour, great, or go for a run. It's really, oftentimes when we are physically exerting ourselves like this, we will find a relief in stress. Very, very important. Good sleep, reading a good book, whatever it is that brings you a sense of peace, you definitely should do more of. And I know it can be difficult with all the demands of modern life, family, work, but try to fit it in to take care of yourself in that way. And be kind to one another right now. A lot of people are under stress, and what I will often wonder is if, somebody maybe cuts me off in traffic, is rude to me. It's that, they're hurting. They're maybe rushing to help out a loved one. You just never know what somebody else is going through. So just try to let it go. So that's my message to everybody. Just let go. Take care of yourself right now. Eat well. Get some exercise. Whatever is good for you. Some people it's going to be 5 minutes around the block. Other people it's going to be running for 10 miles. So not me. So just my thoughts are with you, and take good care. Bye-bye. Oh, before I say goodbye, I do have some blogs on my website about the adrenals, and I don't actually know if I mentioned why it's so bad. And again, I'm under stress, but it's really, stress is so bad in perimenopause because it's called the progesterone steal. So progesterone would convert to cortisol, which is that main adrenal hormone, and we can't live without it. It's the most important hormone in the body. You will die without cortisol. So, and I have only seen one patient in my whole career who had no cortisol. So, and that's called Addison's disease. She was already under treatment. So it is the most important hormone in the body. And so when our brains sense stress, they immediately say, okay, we got to keep you alive. We're going to, convert everything to cortisol. We're going to shut down periods, so you don't get pregnant, and shunt it all to cortisol. So over time, what you can get is this worsening PMS, because progesterone levels are really important to stabilize mood, help calm anxiety, help our sleep. So greater irritability, longer PMS, more the mental emotional side of PMS. Heavier periods though as well, because of that lack of progesterone. And then we get that other hormone involved, DHEA, which is also an adrenal hormone. And DHEA will convert to estrogen and testosterone, and it can actually rise when you're under stress, and then it'll drop down to nothing. And that's what we call adrenal exhaustion. I've got a lot more of that on my website. And then you don't have that DHEA to convert to estrogen and testosterone. Now, for women earlier in perimenopause, that's not so much of an issue because the ovaries are producing that. But later on in perimenopause, that DHEA from the adrenals become more important. So this is why we really see that worsening of PMS in perimenopause when women are under a lot of stress. So that's how it works, and you can find out more on my website. And again, I just wish you all peace and joy and love during these difficult, stressful times. Take care. Bye-bye.